Good morning, ma'am. I am your student nurse for this morning. I am Dan Mercy Yepes. This morning, I will be performing the assessment of the male reproductive organ. First, we're going to perform is the penis. We need to check first part of the male reproductive organ is the penis, the scrotum, and the inguinal area, and the anus, and the perineal and rectal area. First to perform is on the penis. But before that, right, we have to identify our client. We need to check the symptoms of our client. So we need to gather all the equipments. We have here, all right, the gloves. We have the pen light. Later on, that we're going to use that during the examinations or the trans-illuminations of the to check if there's any presence of hydrocele, right? If there's any, if there's of course, by using our gloves. We need to use gloves later on to check the inguinal areas, right? So in this one, so first to perform is we have to explain, okay, the procedure to the client. Sir, good morning, sir. Today we're going to perform the assessment by assessing, by inspecting, and by palpating. If you allow me to perform this procedure to you. So this is not the actual patient. So assuming that I have actual patient, right? So the patient is in, the patient either is on the supine position, either the patient is on the sitting position. So in this case, I ask the patient in the standing position. Sorry, it's not sitting position because we cannot evaluate. We cannot assess more by sitting. So I ask the patient to stand up. And of course, we need to ask the client to put on gown. So assuming that the client have been wearing the gown. Next to perform is the penis. Alright, so the penis, sir, can you please stand up? Alright, by using the gloves. So I will be checking the penis. In this case, so assuming that my client is in the standing position, so we need to check, of course, the pubic hair. Alright, so the pubic hair, we need to check the distributions. We need to check if there's any infestations, if there's any infestations around the pubic hair. And of course, we need to inspect, okay, the skin, the shaft for rashes. Alright, so in this case, so the patient is in the normal findings. There's no any signs of infestation. There's no signs of redness. There's no signs of swelling or discharges. Right? Next to perform is we need to palpate, or we need to inspect, okay, the foreskin. Okay, so in this case, the patient is sorry for this one. Alright, so in this case, I have not yet my client, so I have, while inserting the gloves, so I need to inspect. Alright, so in this case, so my client, okay, have been circumcised. Okay, so have been circumcised. Alright, so okay, so this one, you need to check the foreskin. Alright, so in this case, alright, there's no any what do you call this? There's a there could be skin integrity. Alright, so we need to check first is, of course, the glans penis, on the glans penis. Alright, so in this case, okay, so it's in the normal size, shape. There's no any lesions. There's no any ulcers that could possibly seen on the around the glans penis. And of course, yes. So in this case, there's no any abnormalities or unusualities findings around the penis. Right. So next to perform is the scrotum. So the scrotum, so we need to inspect the size, the shape, the location. So in this case, So the scrotal or the scrotal area, the scrotal sacs, they are not in balance. Right? So the other testis is bigger than the other one, considering I think the temperature, and then there's no any lesions, there's no any discharges, right? So in this case, right? So the rashes, redness. So as I lift the scrotal area, okay, and check it to the base, right? There's no any abnormalities, right? There's no any if you check it, right, the rugy part of the scrotal area, it's firm, and there's no any lumps. So in this case, right, so there's no any problem, there's no any problem that being possibly on the scrotum of the client. So of course we need to use, okay, the flashlight. So assuming that I use a available pen light, so I'm using the pen light. Okay, so ask the client to face on you, or either ask the client to, or the patient to lie down. Okay, we need to just use the pen light to trans-illuminate the scrotal. Okay, if there's a mass, okay, swelling was noted, so look for a red glow. Alright, so if there's a mass or swelling was noted, so we need to check is a red glow. So in this case, alright, so there's no mass or there's no swelling, okay, that are present on the scrotal